Cleaning is the critical first step in reprocessing any medical device before high-level disinfection. Suppose the probe, scope, or instrument is not effectively cleaned before high-level disinfection. In that case, the disinfectant won't be effective, putting the patient at risk of a healthcare-associated infection, or HAI. Improper cleaning leads to improper disinfection, which can lead to an HAI. This demonstration looks at two processes for ultrasound probe cleaning: manual cleaning by healthcare workers as per the manufacturer's instructions for use, and automated cleaning with the Ethos Ultrasound Probe Automated Cleaner Disinfector. A fluorescent dye is used to soil each probe and allow us to see the results and check the effectiveness of each cleaning. 3 separate ultrasound probes are featured. Let's get cleaning. The technician is manually cleaning probe 1, following the IFU. This looks clean, right? Now let's turn down the lights and see what's left on the probe. Moving on to the next probe, a technician performs manual cleaning, again following the manufacturer's instructions. Here's the second probe, cleaned by the book. It appears clean and ready. But under black light, contamination is clearly visible. A technician now performs manual cleaning on the final probe per the provided IFU. Even after careful cleaning, it looks pristine. Yet again, black light exposes hidden soil that simple visual inspection would miss after manual cleaning. Three ultrasound probes have been cleaned following their individual instructions for use. Let's see what happens when the process is automated. Using the same 3 probes and the fluorescent dye, each will now undergo automated cleaning and high-level disinfection. Probe 1 is prepared for Ethos by simply removing the procedure cover and placing the probe directly into the machine. Following simple on-screen prompts, the user enters data about the probe, themselves, and the chemicals being used to reprocess the soiled probe. Once data is entered, Ethos automatically cleans and high-level disinfects the ultrasound probe. At the end of the cycle, a benefit of an automated system is the report generated by Ethos. All aspects of the reprocessing of the ultrasound probe are documented. The automated cleaning and disinfection process is complete, and the probe appears to be clean. Now let's turn down the lights and see if anything is left behind using black light on the probe. Moving on to probe 2, Ethos is finished with the cycle and the probe appears perfectly clean. Let's check under black light to be sure nothing is left. And finally, probe 3, the last in the series. Ethos has completed the cleaning and disinfection, leaving it looking pristine. Different ultrasound probes present unique challenges during manual cleaning. As you've seen, more effort is required than initially thought to completely clean a probe. Probe geometry, materials, and design can all contribute to a greater risk of improper cleaning. Probes are designed to perform screenings on various body parts or cavities. They are not designed with ease of manual cleaning in mind. By automating the cleaning and high-level disinfection process, you see the risk of improperly cleaning ultrasound probes is reduced, thus reducing the likelihood of an HAI. Through automation, Ethos produces the same safe and effective outcome each and every time. What looks clean to the naked eye may not actually be clean. Automation performs cleaning the exact same way each time and eliminates all the challenges seen in manual cleaning. Thank you for watching this video.